4 years ago, a really significant change was made for people who are going through a mental health crisis. The hotline number for the Suicide and Crisis Line shortened to 988. And now 4 years later, we want to check in and see what the impact has been. Becky Stoll from Centerstone is here joining me. When people dial 988 or they text it, some of those calls are routed here in Tennessee. Yes. Can you kind of pull back the curtain and tell me what happens?
Of course. So individuals can call, chat, or text into 988. And when they do, they're going to be engaged with a trained, competent, confident, and skilled, highly trained individual who is, first going to initially try to listen to what is the issue going on. Is it around a mental health disorder that they have? Is it, basic needs that aren't being met? What has really put them into what for them has been a self-defined crisis?
The important thing that I think people may not know is that there is a lot of follow-up. When you dial 988 and you are in crisis, it is not just one call or one text. There is follow-up to make sure you are still doing okay and you're on the path to help.
Yeah, and I think that's why it's significant. Last year in Tennessee alone, there were about 145,000 contacts that were into the 988. There's 8 centers answering these contacts. 145,000, and that was about a 50% increase from the year before. So the post-crisis piece is really vital, and I view those folks that do that in our system and really across the country where that's happening is we're kind of acting as a wingman for someone. We're in the boat with them and going, I'm not just going to throw a lot of resources at you, but I'm going to call you tomorrow.
Yeah.
And I'll call you for a month if you need me to call you or 3 months. I will help you navigate this system and get your needs met. Because we're really not here just to keep people alive. We're here to help people have lives they feel like are worth living.
Are meaningful, exactly.
100%.
There's so much we could dig into, but we want to, I think, remembering that you have a wingman and somebody in the boat with you when you make that first step and call or text 988 is the perfect way to go. Becky, thank you.
Thank you so much for bringing this to light. We appreciate it.
And if you call 988 for help, we want you to know you are not alone. More than 300,000 Tennesseans have reached out just over the last 4 years. The State Department of Mental Health and Substance Abuse Services reports that 54% of cases need some type of de-escalation. 21% are referred to non-emergency mental health services. And just 2% of cases require immediate medical intervention. In the last year, 988 workers have taken more than 93,000 phone calls and answered nearly 52,000 texts. A previously hidden Senate Ethics Committee